Good morning, everyone. My name is Maya Luria with TMC for Seniors. And today I'm really happy to be able to share with you a little bit about TMC's Wound Care Clinic. This presentation is Ouch, Do You Need Wound Care? And today I've got with us Dr. Shara Ducharme. She is the medical director over at the TMC Wound Care. She's board certified in general surgery and was a fellow of the American College of Surgeons. She provides premier care in all areas of general surgery. So thank you so much for being here, Dr. Ducharme.
Hi.
So I'll go ahead. I'm going to go ahead and put your PowerPoint up. You may be watching us today on either our YouTube channel or on our Facebook page. Please feel free to leave any questions in the comments and we'll address those afterwards. So welcome, Dr. Ducharme.
Hi, thank you. Okay, so ready to go. Today we're going to talk a little bit about skincare, especially as how the skin changes as we age, and do a little extra on foot care and kind of within the realm of skincare, but kind of delve a little bit more into basic foot care. Next. Okay, so the objectives of talking today is to understand the functions of the skin, and then how the skin changes as we age, and then what factors make or contribute to skin changes as we age. We'll talk about a couple of common skincare problems, some do's and don'ts with skincare, how basic foot care is very, very important, and steps that you can do for taking care of your feet. And then when is it okay to manage stuff yourself, or when do you need to see someone, see your physician, see a podiatrist to see about what's going on with your feet. Next. Okay, so healthy skin. We're going to talk about healthy skin. And yeah, next slide. Oh, I think we were missing no, never mind. So the skin is actually an organ, just like the liver and the spleen and the digestive tract, and it's considered the largest organ of the body. It helps protect you from the external environment. It protects against the entry of bacteria, viruses, and other foreign objects into your body. And it's relatively waterproof. It protects you against the sun and heat, and from other factors in the environment. It regulates your body temperature, and that's something that's important as we age. It has more troubles with that, but because of the layers of the skin, it does help regulate with your body temperature. It provides sensation, so you feel sensation as in pain, pressure, proprioception, so kind of where your body is at any particular time. It communicates, so the skin, through those sensation factors, it causes your body to, the skin communicates with the rest of your body. Like you touch something, ow, that's hot, communicates with your nervous system, remove that from that offending factor. It also controls fluid and electrolyte balance, or helps control fluid and electrolyte balance. And that's partly because of the relatively waterproof nature of the skin, so it keeps your fluids in, and then also sweat glands help with releasing fluid and cooling you down. Okay, next. Okay, this is the layers of the skin. So this is healthy skin. We're missing a little bit the bottom layer of the subcutaneous tissue, or the fatty layer. But these are the layers of the skin. The top layer, I hope you see my mouse, but the top layer is the epidermis. Okay, so this layer all the way down through here is the epidermis. And it, like I said, this is the layer that's relatively waterproof and can prevent most bacteria and viruses and other foreign objects entering the body. It also produces melanin, which gives skin the coloring, and hair the coloring. Okay, the next layer below here, this is the dermis. Okay, this big layer here that's got all of these other items in it. And the dermis contains nerve endings. I don't really see this. This might be a nerve ending. Hard to tell on this picture, but it contains nerve endings which sense pain, pressure, temperature. It contains sweat glands, which produce sweat in response to heat or stress. Sebaceous glands, which are attached to hair follicles, and these sebaceous glands secrete sebum, which is a natural oil, and that lubricates the hair follicle, lubricates the skin, and makes the skin moist and soft. The dermis also has the blood vessels in it, which obviously provides the blood supply to the dermis and the epidermis. Each of these two layers actually can also contain collagen, which helps with the support of the skin and the epidermis, and elastin, which provides the flexibility and strength of the skin. Now, the layer beneath this that you can't really see is the fatty layer, which provides insulation for heat and keeps your body heat in, or also it's a protective padding. So especially over pressure points like hip bones and elbows and knees and areas like that, it provides a little bit of padding to protect the tissue from pressure. And it also fatty tissue is an energy storage area. Okay, next slide. Okay, so the normal aging process. The skin becomes thinner, and it's not necessarily a loss of cells of the epidermis or dermis. It's the cells become smaller, and that makes you have your tissue is less elastic because you're also losing your collagen and your elastin. So the skin becomes less flexible, less elastic. And so that was you also decrease your fatty layer underneath the skin. So you have more, less protection, and it can cause the skin to sag because it's not it's not able to snap back and keep its normal stretch or normal elasticity. Because of all these changes, it becomes more fragile. You can have more risk of bruises. The blood vessels become more fragile, so you can get bruising underneath the skin, and skin tears more frequently from less trauma than if you had younger skin. Just a gentle touch, or even pulling off a Band-Aid, where you pull off a Band-Aid when your skin is more flexible and more elastic, doesn't cause any troubles. But as we get older, even something as simple as taking off a Band-Aid can cause bruising where that adhesive was. It can cause a skin tear and just pull off that top layer of skin. Also, we lose our production of the natural oils, so the sebum production decreases, so skin becomes drier. We get let's see here, also produce less sweat. So it's harder to keep cool. As all of these changes kind of create increased wrinkles, you can get age spots, which are called lentigos, skin tags, etc. So all of these things happen due to all the normal aging process. Okay, next. Okay, so to care for your skin, that's very, very important. And actually this is kind of at the bottom of this list, but one of the biggest things to do to care for your skin is to avoid the sun. So many problems that happen with skin issues or damage to the skin are from exposure to the skin. So protecting your skin from the sun is something that you have to start young. Okay, so that's not something that all of a sudden at 50 you're like, oh my gosh, now I have to start protecting my skin from the sun. This is something you need to start protecting your skin from the sun from a very young age. The sun exposure causes decreased elasticity of the skin. It causes you to have skin growths. It causes skin cancers, and also with some pigment changes. Other ways to care for the skin: make sure you keep your skin clean and dry. You want to be gentle though when you're doing this, so you don't want to scrub, and you also want to use warm water. You don't want to use hot water. You want to make sure that that water is not going to burn you. Water temperatures that you could tolerate as with at a younger age, it becomes more damaging and causes increased problems with burns and damage to your skin as we get older. You want to use mild soaps and moisturizers. That's something where things that are very mild are many over the counter, but you want to stop using the antibacterial soaps that say they kill 100% of everything. Those are kind of damaging. Also, the very smelly ones, like for the guys, I say the Axe. So if you're using Axe body wash or oil of Olay, a lot of those are very are rough on the skin, and they cause your skin to dry more and cause some damage to the skin. So, and that goes with not just the soaps. You also want to make sure your moisturizing lotions or creams are very mild and gentle on your skin. Again, these really strong moisturizers that smell really pretty often are very damaging to the skin. You also want to avoid adhesive on the skin as much as possible, because as the skin becomes thinner, the skin is more prone to tear, like I said before, tearing and bruising underneath some of those adhesives. If you notice that you have an area on your body that's becoming irritated with either from rubbing of clothing, rubbing of your shoes, you don't want to ignore it and think, oh, it's just going to get better. So pay close attention to it, keep an eye on it, check it. If you can avoid that, whatever's causing the irritation, avoid that so that your skin doesn't develop a wound. Also, soft clothing. If you buy new clothes, you want to make sure you wash them with a gentle detergent before you wear them, because clothing that's fresh out of the pack or fresh off the hanger at the store can be much more rough and irritate the skin and can cause some skin breakdown. And then again, avoiding the sun is a big one. And then also not smoking. Smoking is a big contributor to wrinkles and causes a lot of troubles with skin damage. It damages the blood vessels that go to the skin and can cause a lot more troubles with wrinkling. Okay, next. When you're cleaning your skin, okay, you also, like we said before, you also want to make sure it's a mild soap and warm water. You don't want to be using this hot, too hot of water, because it does damage the skin. Don't want to soak in the bathtub or a swimming pool or a hot tub for prolonged periods of time. It's damaging to the skin to be soaking in the water for long times. When you're getting out of the shower or the tub, make sure you dry everything very thoroughly. If you have moist areas, especially in skin folds, that can cause skin breakdown, skin irritation. It can cause fungal infections, especially in skin folds, between your toes and other areas like that. After you've washed and dried, you want to make sure you're putting a nice gentle moisturizer on that, especially as we get older, because from all the other reasons that we've mentioned, skin gets drier as we get older. With the lotions, chemicals such as the lanolin, the coal tar, alcohol are very rough and damaging on the skin. They may be fine when you're younger, but you don't want to be using those as the skin gets older. It causes more damage to the skin and causes them to become more dry and more prone to breakdown. You don't want to put lotions or creams between your toes. That's just, it causes the moisture in there, and it can cause increased skin breakdown. When you try a new product, always don't buy a new product and then put it all over your body and then be surprised that, oh my gosh, I have a rash now everywhere. You want to make sure that you're putting new lotions on, try them, in your arm or somewhere that you can monitor it and make sure that you're not going to have a rash or irritation from that. Okay, next. Common skin problems. It's estimated that about 90% of older patients or older people have some kind of skin problem. And a lot of these are due to sun exposure. There's medical problems that can predispose to a lot of these skin problems. Blood vessel damage, such as arterial sclerosis. Diabetes is a big one, heart disease, liver disease, nutritional deficiencies such as protein malnutrition, obesity, reactions to medications, and even stress. Also, other environmental conditions that can cause you to have some skin problems are allergies, climates, so too hot, too cold, certain clothing, and exposures to chemicals either at work or at home. And so some of these common skin problems that people can develop, the dry, cracked, peeling, or weeping skin, especially people get a lot of that on the hands, on the feet. Those are something to really pay attention to, because especially wounds on the feet can progress to very severe issues. Other problems, things such as blisters from rubbing on clothing, rubbing on shoes. Blisters can happen from reactions to chemicals or from sun damage. You can get skin bumps with pus underneath them. You can get cellulitis or skin infection that can cause an abscess or a wound on your arms, legs, or body. Skin tears. As we get older, the skin becomes much more fragile and much more prone to skin tears. And sometimes you don't even know that you're developing a skin tear, and all of a sudden you've got this big flap of skin hanging off your arm or leg that you didn't do anything excessively traumatic, but develop these skin tears due to the fragility of the skin. The dry, cracked, and peeling skin, especially when it gets to be on the feet, can cause fissures on the feet. We see a lot of these on heels, where these fissures happen where the skin is so dry and cracked. And it seems like that fissure is just in a callus type skin, but that can go deep into the actual skin and tissues of the foot. And then a lot of these things can develop into a wound. So anytime you have a wound, it's a good idea to have that looked at. Okay, next. Okay. I wanted to actually, before I got to this, talk a little bit about neuropathy. So there's not a slide for it, but neuropathy is a big issue that can cause skin problems. So neuropathy is estimated that about 20 million Americans have some degree of neuropathy, and that can be that's due to damaged or diseased nerves that can cause decreased sensation to the extremities. And because we're going to be talking about feet, I'll talk a little bit about neuropathy in the feet. Now, neuropathy can cause sharp pains in the legs and feet. It can cause numbness and tingling. It can also cause weakness at times. Some of the big factors that contribute to peripheral neuropathy, a big one is diabetes, from having high blood sugars, and those high blood sugars cause damage to the nerves, which make the nerves less likely to have sensation, and then you develop wounds and you don't know that they're there. Other things that are factors that can cause neuropathy. Injury, so injury to the spinal cord or injury to the legs, sciatica, injuries to the back can cause peripheral neuropathy. Increasing age is actually also a factor that can increase the risk of having this peripheral neuropathy. There's several autoimmune disorders that can cause this, in addition to heavy alcohol intake, and then chemotherapy. So with the neuropathy, you have an increased risk of injury. Okay, so general foot care and hygiene. Very important to check your feet every day, especially as we get older because of the neuropathy, because you may not feel small injuries that develop. So checking your feet every day, the entire foot in between your toes. If you can't see your feet or can't reach your feet, having a significant other, friend, family member, someone look at your feet every day is something that's very important. If your feet are dry, you want to make sure you're using a moisturizer on your feet, but again, you do not want to put it between your toes. If you're starting to develop corns or calluses, see if you might need to have a different pair of shoes, but you need to have those taken care of and have those looked at either by your physician, by podiatrist. And then also, if your toenails are getting long, you want to make sure that you're cutting your toenails. You want to make sure that you're cutting them properly. And if you can't cut the toenails or you have fungal infections of your toenails, those should get addressed to see if those can be managed, taken care of by your physician. Okay, next. Okay, I already talked about this a little bit, but inspecting your feet daily, very, very important. If you have, there's multiple people who actually have no one who can help them check their feet. But if you're able to utilize a mirror, or hopefully you can have manage to see all of your feet and check it. But if you can't check your feet and you have no one to check your feet, seeing your physician routinely is a very, very good idea. And make sure that say, hey, can you please check my feet? I can't check them. I don't know what's going on, and get at least someone looking at your feet as often as possible. And then you also want to make sure that you're washing your feet daily, checking the water temperature to make sure it's not too hot, especially if you've got some degree of peripheral neuropathy. You want to you don't want to burn your feet or cause damage to the skin of your feet from water that's too hot. Okay, next. Okay, with your shoes, you want to make sure you're getting shoes that fit you. So getting them fitted by a professional is actually a very, very good idea, especially as we get neuropathy in the feet, have troubles with corns or calluses. It's very important to have someone actually fit you for your shoes to give you the best chance that those aren't going to cause increased damage to your feet. It's also a very good idea to buy shoes late in the day because our feet swell over the course of the day. So the shoes, if you buy them in the morning, they may fit great and they feel really comfy, but over the course of the day, they can have some pressure points or cause rubbing or calluses or wounds on your feet. And when you're getting new shoes, you want to make sure that you don't put them on and wear them all day long. You want to wear them for short periods of time initially to, break them in. And you want to check your feet after wearing them. Even if you don't feel like they're rubbing, you want to check your feet to make sure that you're not developing some redness or skin breakdown, skin irritation, stuff like that. And then frequently while you're breaking in new shoes, you want to keep taking your feet out of the shoes and checking them to make sure that you're not developing any wounds or issues with your feet. Okay, next. When you're getting shoes, it's very hard to say, okay, these are the only shoes you should wear, because some of the correct type of shoes are not necessarily the most flattering types of shoes. But it's important to wear the shoes that you're going to wear for the most periods of time, for the longest length of time, are the correct type of shoes. You want a soft leather or athletic material, something that's not going to be tight and rubbing. Again, when you're breaking your shoes in, break them in slowly. Wear them for a little bit at a time. Check your feet, and then a longer length of time the next day. When you buy or wear sandals or open-toed shoes, just be very, very careful when you're wearing those, because you want to make sure that you don't have any rubbing of your feet on sides of those shoes. You want to make sure that your toes are protected and the foreign bodies aren't getting between your foot and the shoe. And when you're wearing shoes, you really should not wear shoes without wearing a pair of socks. The appropriate socks are going to decrease the rubbing of your skin on the shoes, which can cause increased breakdown. They absorb moisture of the sweat from your feet, which helps with skin breakdown also. Okay, next. Okay, this is our stockings. Always, always wear socks or stockings. If you have some degree of leg swelling or varicose veins, wearing compression type stockings actually are very, very beneficial. And they have compression stockings that go over the whole foot and cover the toe and go up to the knee, or there's ones that have open toed. And again, if you're wearing an a compression stocking that doesn't have covering over the toe, then you should wear a pair of socks over the top of that. You want to avoid the synthetic materials because they tend to be thinner and they absorb the sweat and fluid on your feet less than cotton or wool. Again, so you want the pair of socks that absorbs the sweat and provides a padding between your bony prominences and the shoe. You don't want to wear socks that are too tight because it can cause decreased sensation even more to your feet, and also can cause rubbing and ulcerations and wounds. Next slide. Okay, some do's and don'ts for the feet. So just like when you're taking your dog for a walk, you want to check the ground to make sure it's not too hot for the dog. You always want to do that for yourself as well. Don't walk on hot pavement or hot sand, especially if you have some degree of neuropathy, because it's not going to feel as hot to you, and people can develop horrible blisters and burns on the bottom of your feet, and you don't even feel it. You don't know you're developing those blisters or wounds, and it's very, very hard to get those to heal, again, because they're on the bottom of your feet, and they can cause a lot of tissue damage. You want to also, when you're putting your sunscreen on, don't forget your feet, especially if you're wearing sandals. Make sure you get the tops of your feet covered with sunscreen, because those sunburns there, especially again, if you have some neuropathy, you can develop quite a severe sunburn without noticing that that's developed. When you are in the bathtub and shower, make sure that your water is not too hot. Just like when you're checking for babies, you check the temperature of the water with your elbow. You want to make sure you check it for yourself with your elbow to make sure you're not going to damage your feet and the rest of your skin with water that's too hot. If you develop a corn or a callus, for the most part, you don't want to be cutting those off yourself. If you develop those, you want to see either your podiatrist or your primary care doctor to see if you can get those removed, if they have or even sometimes a dermatologist. But you don't want to be cutting those yourself, because it can cause damage to your skin and underneath that. When you're cutting your toenails, you want to be very careful that you're not causing damage to the skin around the foot. If there's any concern that you feel like you can't cut them, or you're going to hurt yourself, podiatrists do a lot of toenail clipping, and also they can manage nail diseases. If you have thickened nails, fibrotic nails, you have nails that you can't cut because they're too thick, then the podiatrists have special tools and can cut those in a safe manner for you. Okay, next. Some more do's or don'ts. You don't want to use hot water bottles or heating pads on your feet. If you've got an injury to your foot and you've been told to keep the feet warm, be very careful. You want to put padding between, or covers between the heater and your foot, and you want to check it very, very frequently to make sure it's not too hot. If it's too hot for your elbow, it's too hot for your feet. When you're in a car, for a long trip, the heater where comes out the dash or the foot, or the footwell, make sure that that's not too hot for your feet, because that can be something where you don't notice that there's a bunch of hot air coming out there, and it can cause some burns and damage to your feet. When you're checking your feet daily, always make sure that your toes are clean and that you don't have anything between your toes. A lot of times People forget to clean in between their toes, or they don't notice that there's, they were walking out of the shower and some debris got stuck between their toes. Make sure that your toes are between your toes are clean and dry and don't have any debris between them, because those can cause ulcerations and other wounds. Okay, next. So again, neuropathy, like we're talking about, is a very common problem, and you can have loss. So neuropathy can cause pain, but then also the problem as far as with wounds, with the wounds and wound care, is when people have decreased sensation in their feet. And it can be something that you don't realize is happening, and you don't notice that you have decreased sensation until it actually gets checked. So or you should always get your feet checked for sensation when you're checking your feet every day. Sometimes just doing some light touch or having someone touch your feet to see if you are losing sensation. But people can lose a little bit of sensation, or they can lose all of their sensation and have completely numb feet and not feel anything. And when you lose sensation to pain, that is when people have the greatest risk for foot ulcers. And foot ulcers are very, very, or can be very, very dangerous. They cause significant risk of loss of your limb, or even loss of life, with the infection that can happen from these. And this is why it's very, very important to check your feet every day, because little tiny wounds can happen and you don't notice them because you don't feel it, and those can develop into major life-threatening problems very, very quickly. That's, and again, reasons why we should never walk around barefoot. Stepping on, hot sand can burn the feet, cause the ulcerations. Walking on small rocks that you don't even feel can cause ulceration of the foot as well. And when you have this loss of sensation, even a mild trauma or even some major traumas, you can't feel it. You don't, if you're not checking your feet, you don't see it. We talked about the reasons, the medical problems that can lead to loss of sensation. And one of the biggest ones was the diabetes. So if you have diabetes for more than 10 years, your risk of foot ulceration increases because your risk of neuropathy has increased. Okay, next. There's multiple different tests for checking for neuropathy. Your podiatrist or primary care doctor has these monofilament tools, touching with something that's cold, something that's hot, to check your temperature sensation, to see if you still have temperature sensation. And then there's light touch, there's sharp touch. And this monofilament is something that is placed on certain positions on the feet and can detect very minimal amounts of pressure, and is very sensitive for determining if there's the beginnings of loss of sensation in the feet. When you lose sensation in the feet, again, that's called loss of protective sensation. And that's very, very important, because sensation is very protective for the feet, because if you can't feel that you're having a pressure point, or you can't feel that you've got a rock in your shoe or a little tiny pebble in your shoe, that's when you can develop wounds without knowing them. Okay, next. So when you have loss of sensation of your feet, a big important issue is make sure you're doing the daily foot inspections. Okay, there's your podiatrist or your primary care doctor can recommend shoe inserts and sometimes special footwear. Again, it's not that some of these shoes are not the sexiest shoes. However, it's better to have the right footwear and keep all your toes and your foot than have to have toes or parts of your foot amputated. It's important. Preventative foot care is very, very important. And preventative foot care is proactive measures to protect and care for your feet, which can reduce the possibility of incurring serious problems with your feet that you're more prone to developing as the feet age. Preventative foot care is very, very important in all sports and athletics. It's also very, very important in home activities, work activities, and even just walking around in the house, daily walking, daily work. It's very, very vital in everybody, but especially in people with chronic health conditions like diabetes, or arthritis or circulatory disorders. Without preventative foot care, small problems can develop into very large problems that threaten your limb and life, actually, and they can happen very, very quickly. Okay, next. It's very important, especially for anyone, but especially as we age, to see your doctor regularly. Even if you feel like, I don't have anything wrong with me, it's good to go see your doctor. Make sure you don't have small problems that are going to develop into large ones. And also, make sure you're taking your shoes and socks off at each visit. And ask your doctor if they don't tell you to do that, or if they say, oh, why are you taking off your shoes and socks? Tell them, hey, I would like you to check my feet as well. Please make sure that there's no issues going on with my feet. Very, very important. Even if you're checking your feet every day, it's important to have your physician, podiatrist look at your feet as well. If an extra visit to your doctor, if you develop an area of poor color, so your foot normally is kind of pinkish, light or tan or pink, or but you turn a different color, it becomes much paler, or it becomes red. You want to make sure that you see your doctor if your foot has an area where it turns cold. And no matter what you do, it's not the same on both feet, or one foot turns cold. One foot develops a blister, or you develop a callus or a sore. If you notice that you're having foot pain that you weren't having before, if you have to dangle your feet over the bed because your feet hurt when they're elevated, that's something you definitely need to see your physician for very quickly. If you notice that you're having change in sensations on your feet, that's important to see your physician to make sure that you are wearing the appropriate shoes. It's also important to see them so that if you need vascular intervention, if you need additional screening with ultrasounds of your blood vessels in your legs, to make sure that your blood vessels are bringing blood to your feet, bringing blood back from your feet, make sure that those are giving adequate perfusion to your legs. Okay, next. Okay, so that's just a little bit about skin as we age. Very, very important. Take care of the skin you're in is the slogan there, because once the skin has damage to it, it becomes very difficult to maintain a healthy skin. So you want to make sure that you're taking care of your skin to help prevent a lot of these issues that can develop into wounds that can be very, very difficult to heal and can be life and limb threatening. Thank you.
So thank you, Dr. Ducharme. I had a couple of questions come in. One was about sort of our desert environment, and how does that impact how our skin is drying as we age, just in our environment?
That's very damaging to the skin, because the skin is in the desert climates, it's much drier, so it's harder to maintain the moisture in your skin. So it's more important. We're more prone, especially because we tend to be out in the sun more. Even so, wearing the sunscreen, making sure you're moisturizing as well as that, because the combination of the dryness of the air and the sun really increases our risk of wrinkling much more than in the cooler climates.
And can physical activity speed up skin problems on your feet and hands at all?
Sometimes, if you don't have protective shoes, people call something called runner's feet. Okay, so runners are much more prone to have nail loss on their feet, blisters, calluses, and from running. So, but then a runner tends to be a healthier individual, so you're less likely to be obese or have chronic medical conditions if you're out there running all the time and have that horrible runner's feet. But wearing the appropriate footwear, Wearing appropriate padding is very important because runner's feet are something that can, you're more prone to develop wounds on the feet because having the calluses and constant friction on your feet. Other sports, baseball, if you're not wearing, or soccer, baseball, if you're not wearing shin protection, as we get older, that if you get hit with a ball and the shin, that can cause, the skin is, there's less fatty tissue there. That can cause wounds on the shins. We see a lot of wounds on the shin from sporting activities, and actually from, home activities too. The shins are pretty common to get wounds. But just making sure you're wearing the right shoes, the right inserts, the right socks. All that is very important when you're protecting your feet and your legs from sports.
And are there ways to help slow down the process of your skin thinning?
Yes, sunscreen. That's the big one. So for, as that's something that starting early, very, very important. But it's never too late to start. Covering up your skin with wearing a hat that covers your face, covers your neck. A lot of places we forget to put sunscreen in the ears. Okay, the ears. You're wearing your hat, you've got your baseball hat on, but then your ears are sticking out. So making sure that you're putting sunscreen on everywhere, on your feet, on your skin, everywhere, and protecting your skin. If you can't, even better than sunscreen is wearing the UV protective clothing. There's, when you're in the pool, they make bathing suits or tops that cover a lot of your body. And so keeping your skin out of the sun is better than sunscreen. But sunscreen is still very, very, very helpful and is something that we really need to put on. But then you also, with sunscreen, need to make sure that you're reapplying. It's not, you can't put it on in the morning and say, okay, I'm done, I put on my sunscreen. That's when, if you're going out and about, you bring your sunscreen with you, you keep reapplying it. It really needs to be reapplied probably every 90 minutes or so, more frequently if you're in the water or there's a lot of wind or you're sweating heavily, but it needs to be reapplied frequently to be working.
And what SPF would you recommend then for, particularly out here in the desert, right? So
as high as you can get. I think they make 100 now. So, if you're the SPF like 5, 10, 15, I would avoid those ones. I would stay with the higher SPF of at least like 50, 60.
okay.
You probably want even more on your face and chest area and your ears. You want, if you can, I wouldn't do the zinc stuff because that's kind of thick and nasty and people aren't going to be very compliant with that. But the SPF 80 and 90, they make ones that are not thick and greasy anymore. Sunscreens have really changed over the past few years, where you don't have to, you're not putting a paste on your face to get good sunscreen. And then also another little thing with sunscreen is, if you have a bottle of sunscreen from last year, you probably need to get rid of that and buy a new one. Those do, they become less effective as they get older. So you really want to make sure that you're getting new sunscreen often. And you should be, because you should be using it a lot. So you should use it up quickly.
That's a great tip, because I think we all stockpile things. And so the older it gets, the worse it's not going to be as effective. Can you tell us a little bit more about wound care, the TMC Wound Care Clinic? What are the types, for instance, when would somebody, when do they need to go in for wound care? Can you maybe just sort of describe a little bit more about the specialized care that you provide over there?
Absolutely. I think that we see all kinds of wounds. We see traumatic injuries, we see diabetic ulcerations, we see venous ulcerations, lymphedema, pressure wounds, skin tears, radiation. People have had radiation therapy, that skin can break down. We also see people after they've had skin cancer surgery, and the dermatologist or surgeon leaves them with a wound, and we heal those. We take care of those as well. So I would say, if a lot of, we are really trying to be out there and making sure that the general population all knows that we have this really great wound center. But some of the primary doctors, not all primary doctors know about us. And if you're seeing your doctor and you have a wound and it's not progressing or it's not getting any better, your primary doctor says, okay, we'll just put this Band-Aid on it and come back and see me in a month. So if that's the case, I would ask your doctor, hey, I've heard there's a wound center. Can I be referred to the wound center? Because we see people once a week, sometimes more frequently. We do, we have advanced wound care. We use placental grafts. We do biologic skin or cadaveric skin grafts on people. We have a strong network of surgeons that we have people see for advanced like flap or closure of certain kinds of pressure wounds, certain kinds of wounds with that need flaps. If wounds need to go to the operating room to be debrided, if cleaned up and get rid of all the dead tissue. We also have a strong network of vascular surgeons that we refer patients to for, we identify and know how to get people treatment for their arterial disease, for venous disease. Sometimes we'll see someone who's 70 years old with diabetes and they've never had an ultrasound of their arteries in their legs. And that's very, very important because diabetics can have artery disease that is silent. So just because you can feel pulses in your feet, a lot of times, especially in a diabetic who's had diabetes for a long time, that's because there's so much calcium in the artery that you just feel a little trickle of blood going through, but it's making that calcified artery pulse very well. So it's very important. We identify nutritional deficiencies. We do a panel of blood tests on people when they come in. If they need arterial or venous studies, we get them referred out to vascular surgeons for those studies, and then intervention if they need an intervention. We also do a wide variety of compression wraps, which are very important for people with varicose veins or venous disease and lymphedema to keep swelling out of the legs to allow the legs to heal. What else? We have hyperbaric oxygen chambers for people with radiation injuries or diabetic bone infections. And so those are a lot of those we are able to identify those and make sure that we get early treatment for those patients. We place skin substitutes and so you don't have to always have the pain of having a skin graft where you have skin off of your thigh and put onto your wound. We can do tissue grafts that help heal these wounds without causing that extra pain of a skin graft. But we also have surgeons that we send people to who absolutely, if a wound is ready for skin graft, we can get that squared away as well. We do negative pressure treatments where there's certain wound care where we put a dressing into the wound and it hooks to a canister that kind of sucks on the wound. So it helps close it up quicker. It brings nutrients to the wound. We have nutritionists at TMC that we can have patients see diabetic educators. We can have them see a nutritionist to talk about if they have protein malnutrition or if they need some reinforcement about diabetic diets. We have bariatric surgeons we refer people to if that might help the patient with some of their medical issues and some of their wounds. So we see all those. If a doctor tells you to put hydrogen peroxide on your wound, you tell them you want to see a wound care specialist.
Okay, great. So I do want to put up as well the phone number for the wound care clinic. It's 520-324-4220. And I know that you are referral based, so somebody will need to receive a referral from their physician. Yes. When they, but that's the number to call. And I mean, you definitely cover a huge gamut of different types of wounds that you're seeing, and I know that for our diabetes clients that the foot care is certainly very important.
And so we get people in very quickly too. So if you have something, if the primary doctor gives us a call, then we can absolutely facilitate getting people in very quickly. So it's not something where you put a referral in and 2 months later you might get an appointment. So it's something that we can see people very quickly.
Oh, that's great information. Thank you. Thank you so much for being here, Dr. Ducharme. I really appreciate it. Please join us tomorrow. We will be doing some brain health, and it's all about nutrition. So we'll be doing Think Big, Back to the Basics for Brain Health. That'll be tomorrow, Wednesday, March 16th at 10 a.m. So we hope to see everybody online then. And thank you for being here, Dr. Ducharme.
Thank you very much. Have a great day.